Hey everybody, welcome back to my channel. Thank you so much for being here. It's been a little while since I recorded a video. I'm trying to keep a little quiet because it is later in the day and I don't want to wake up anyone else in the house. But I've just really been enjoying my break. My winter break is usually pretty long, so I just really wanted to enjoy it and take a break and do as much of nothing as I possibly can before I start my next semester. But I hope everyone is doing great. I hope everyone is doing well in their nursing journey or pre-nursing journey or whatever it is. And I hope everyone is having a wonderful new year so far. When I'm doing this video, there's a lot going on in the world right now. I'm doing it January, today's the 7th, and if you're watching the news yesterday and today, there's a lot going on, but hopefully in time we can get past it and do better in this world. But anyway, the video that I wanted to do today was doing my 4th semester recap, just tell you a quick little synopsis about what happened, what went well, all that stuff, and then I plan to do a separate video discussing clinical specifically, so I can give you tips on how to do well in clinical, how to adapt, how to really get the most out of it that you can while you're there, and not just, doing a little check mark off of it. So I had my adult rotation as well as the class component along with it, and that's all that I had this past semester. The course itself wasn't terrible really. It was very interesting because now we're starting to work with actual patients, whereas where I talked about in my health assessment course for my 3rd semester recap that we were starting to dive into patient care and really getting our hands dirty into that. But again, that's usually working with a volunteer that you've practiced with over and over, but now it's actually working with real patients that you don't get like a test run, you just go in there and do the best you can and all that. But as far as the classwork, we had, the typical discussion boards, a couple of quizzes. I don't think we had any papers or anything like that, but of course we had, a midterm and a final, and the content really isn't terrible in my opinion. There was a lot that of course that we need to learn at once, but what I really thought that was the most difficult component of this semester in my opinion was because when you're mixing the information of the course and the clinical and you're learning it at the same time, when you go to clinical, sometimes you can feel very, very behind because, for example, if you are on week 1 and you're studying diabetes, fine. And then you go into clinical and you have a patient that has a headache and you're just kind of like, well, I don't get to headaches till about week 7 or 8 or whatever. So it's not, you can't just say, oh, well, I can't take care of that patient. You have to do a lot of essentially on the job training, and it's a little bit frustrating because for me I felt like I was always playing catch up because I was seeing patients that had a certain condition or diagnoses before I even got to learn it in school. So that was a little bit frustrating for me because you were always playing catch up, and that's where I felt like the most difficult part was. But at the same time, it was good because if I learned something in school, then I can apply it later when I had that type of patient in clinical. And if I learned something in clinical that I hadn't learned yet in school, I can really understand it when I get the information from school. So in a way, it helped each other. But being in clinical, it was definitely difficult. And I think everyone kind of feels a little bit dumb when you go into clinical, but it's like you feel even worse when you're trying to play catch up because it's not that you don't know how to help them, it's just you haven't learned how to do it yet. So I feel like that was the most difficult part for me to get through. But other than that, I really enjoyed my clinical experience. I'm actually going to go with with my same preceptor again for the family portion, so I'm excited about that. But I really enjoyed it. I really felt like, oh my gosh, this is really real. We're getting to see patients and, they're trusting you with what you're saying and you have to be really knowledgeable, know what stuff you really need to know in the back of your head and what stuff you need to look up and where are appropriate sources to look things up and all that. So, things are starting to get real. You're learning how to be in a practice, learn how they do things and who they refer to, what labs do they use, what, EMR do they use, like all that type of stuff. It's very interesting and it's very surreal and it's like, oh my gosh, this is actually going to happen soon, and it's just kind of a nice first step. But now that I feel like I've actually had the course information from the adult portion of my program. Now when I go back again, I'll feel, I think, a little bit better just because I've had all the knowledge that I need to know so far versus going in completely blank, you know. So I think it's going to be a little bit better situation, and I'm going to make a separate video discussing specifically the adult rotation that I had. I'm not saying, you know, where I am or who I'm with or anything like that, but I am going to discuss how I felt, different tricks and tips and all that helped me do well in that particular practice, and how you can apply it to your own practice when you start with your preceptorship with whomever it may be. But I really enjoyed this semester. I only had one class, which was great. The only thing that was a little bit tedious was that I had to travel pretty far for clinical, but unfortunately, with the video that I did before, which is talking about the reality finding preceptors, sometimes you do have to go far. Sometimes it's not always easy to find, so sometimes if you do find someone, you got to really attach to that individual, because you may not find another place to get it done. So just the driving portion, you know, week after week after week was just kind of like, all right, like I'm ready for a break. So other than that, I really enjoyed the course. The information was great. I feel like I have somewhat now of a basis of information how to take care of patients at the provider level. So it was a great time. I really enjoyed this semester. I'm really looking forward to next semester and going back to clinical, because I really do enjoy clinical. I enjoy, you know, interacting with my patients, learning from them, you know, educating, and just kind of finding my place in the NP role. So thank you guys so much for watching. As always, if you have any questions at all, please feel free to email me. If you have questions specifically of your nursing journey and you don't, you know, want to leave a comment or anything, I don't really care about that. You can email me straight, whatever you need to do. If you need help with your resume or a personal statement or anything like that, you feel free to send it over to me through email. I'm here to help you guys as much as I can. Of course, when I start the semester again in a few days, I might not be as available, but I will definitely make sure to set some time out for that. I hope you guys have a wonderful, wonderful day. Stay safe. Remember to always, always, always believe in yourself, and I'll see you guys in the next video.